It's a great question that we get asked all the time. I've already had my aneurysm surgery. My aneurysm is gone. Why would I need to keep on having CAT scans or MRIs throughout my lifetime? This is annoying. I don't want to keep coming back for these. I want this to be a finished part of my life. And unfortunately, the answer is you definitely need to continue to have scans. And the reasons are because when patient has aneurysm surgery, they might not have had all of the at-risk aorta removed at the time of surgery because of the sizes that they were presented at the time of operation. They may have had a minimally dilated aortic root, but the ascending was very large and they were a young individual, and it turns out that it really would not have made sense to do a very complex aortic root operation at that age, but the aortic root might grow up to be a size that needs surgery at some point in time. And also we're mostly doing postoperative surveillance for patients who have something called pseudoaneurysms. Pseudoaneurysms might occur at suture spots. The suture passes through both the aortic replacement graft and through native aortic tissue, and sometimes, because that margin of tissue is not entirely normal, depending on how it heals or depending on how compliant the patient was, especially in their first couple of years after aortic surgery, they might get these small basically contained ruptures. They're like little mushroom clouds of contrast that we can see alongside aortic replacement grafts. And it turns out that those are not things that you can just ignore. Most of the time, they actually need to be addressed with surgery because the behavior of a pseudoaneurysm might even be more aggressive than a native aneurysm in terms of its propensity to rupture. We have definitely had patients who were lost to follow-up for many years after aortic surgery, and we rescreened them because they found out about us, and we enrolled them in our program, only to find that they've had important pseudoaneurysms that needed to be addressed later on. So unfortunately, the answer is surveillance is really forever. It doesn't mean you need to get a scan every year. If we see stability in either a preoperative scan, somebody who doesn't need surgery, or somebody who's had surgery, typically if we see a stable scan after a couple of years in a row, we'll start to spread out the interval of surveillance. But we actually might have patients who we might call back for scans or have on our list to have another scan at 5 years or something like that, just so we've never truly forgotten about it.